Dear friends, dear colleagues, welcome to the ESGO Engage Patient Advocacy Week. This year, for the first time in the world, we intended to listen different stories from different countries, different doctors and patients. What's going on in Europe? Are you ready to listen us? Then please follow our Facebook and web page and meet us in the Patient Advocacy Week 2020.
In the name of ENAGAGE, I warmly welcome everybody. This COVID pandemic rewrote our originally planned program in ENAGAGE, so now we can meet online. Professor Murat Gultekin and I would like to open this week, the Patient Advocacy Week of ENAGAGE, and we launched some storytelling on our Facebook page and best practice sharing in our Facebook group. We will have webinar, we will have classrooms, and also we will have a social day at the end of the week on Saturday. Let me open this week with my short storytelling or presentation about the importance of patient-doctors communication. Somehow point on that this is very important, and I would like to share it and open this week for our members, for our ESGO doctors, for our supporters, and for those who can join us during this week. I wish you a useful and meaningful ENAGAGE Patient Advocacy Week. Be together. Enjoy the time. The disease brings together and initiates the doctor-patient relationship. It is based on trust, and trust requires the doctor's expertise and communication. Of course, communication is two-way, and respect and understand each other's languages are essential. That is the use of the patient's language. When I was diagnosed with cervical cancer, nothing was clear to me. I saw something wrong on the doctor's face and he referred me to a specialist, but I didn't understand at all. I just did what he said to me to do. It was a lack of communication then. Then I met the oncologist who understandably, slowly explained that I had cervical cancer. He said I was going to have a big surgery that would be hard for me and for him. I could ask, felt the time I had. I understood. I was not urged. I was not pressured. After the operation, he visited me and told me and my family everything we needed to know. He gave me his phone number. I could call him anytime I needed it, if I was desperate for any symptoms. He did not use medical language, but mine. Good communication results in collaboration. Of course, I also knew when to call him, not bother him all the time, so we were able to manage the patient pathway together as best we could. He was very careful what to say if the topic was difficult or even burdensome. He also put it carefully. Of course, not everyone can communicate well, but often a little attention is enough to make the patient journey better, and it is the responsibility of both the patient and the doctor. There was also a doctor on my way who listed raw, semi-understandable the side effects of my radiation therapy. I felt like I was on some sort of death row, desperate and scared. I left. I was looking for another doctor back then, and he put the same information in a different rope to establish my trust. We all know that the soul is so important for the recovery, and the communication is one of the soul shaper elements. Let's hear each other, understand each other, dare to ask questions and give time for the answers. Not an easy task, but we have to work on it.